Today I'm going to share an interesting case study of a patient who came to us with complaints of erectile dysfunction and non-consummation of marriage. So first let me tell you, this patient, he was around 27 years old and he got married and his married life was 2 years. So for the past 2 years, he was not able to have even one successful penetrative sexual activity. So their marriage was non-consummated. So they came to us for this complaint and they had tried with PDE5 inhibitors with other doctors also, but with no result. So when they came to us, we evaluated them. So the main issue which has caused this erectile dysfunction is this patient, he is a known case of juvenile diabetes for the period of last 12 years. So the main cause for his erectile dysfunction happened because of his diabetes. So they came to us and we did a penile Doppler study and we did a assessment and we found out that there was the penile arterial stiffness is very high and there is a damage to the endothelium of the penile artery. So that even with higher dosage of Viagra-like medication, this patient was not able to achieve any erection. So what we offered him is, we offered him a penile implant surgery because all other regenerative medicines won't be helpful in this patient because the damage was to that extent and his diabetes levels are also totally out of control. When we first met him, his HbA1c level is 14.6. So I had told him, so now I can't even operate you for this penile implant surgery because of your high diabetic level. So first we have to control your diabetes and then we have to plan for the implant surgery, and that is the only option for you. So the patient, he met a diabetologist and he started controlling his diabetes, and this for a period of around 4 to 5 months. So after that, again he came to us. So when he came to us, his HbA1c level was around 9.4 and we decided, okay, and his FBS and PPBS levels were around the normal range. So we decided we will plan for the implant surgery because of his controlled sugar levels. So we planned for the implant surgery and we did all the pre-op preparation for him, and we started with him with antibiotics so that to prevent the infection in any case, because he is highly prone to get infected. So for you to understand how much he is prone to get infected, so he had a injury at the great toe of his foot. So that injury, it took him around 8 months to get healed. So now you can understand how much his body had, the healing capacity of his body. So we planned for the implant surgery and we did the implant surgery and we achieved a very good length for him. And the patient also was very happy with the length and the girth which is achieved after the implant. So he was totally happy and the catheter was removed the next day and he was discharged on the third day after the surgery. So the patient went home happily and he came to us for the suture removal. The wound was wonderfully healed after 10 days and he had a wonderful result after the implant surgery. So you can see the glimpses of this surgery and the patient testimonial in this video also. Thank you.